Well, hello and welcome, everybody. Thank you so much for being here. It's so great to see so many familiar and new faces. Ah, It's always a pleasure. And welcome back to the monthly XR News. This is the Medical and Health edition on For Educators in VR. This is an immersive fireside chat where we connect with innovators and explore their personal journeys into XR AI. Together, we're going to have a conversation to see what sparks their passion and how they're using immersive technology to create a real difference in the world of health and wellness. I'm your host, Rachel Darden, a health and well-being educator, and I'm proudly part of the weekly XR News series that's hosted every week here in Engage XR. I invite you to join me every Wednesday of the month as we take a closer look at how extended reality is shaping the future of well-being, healthcare, and the human connection. So, like I said, every week here on Wednesday, we're here in Engage XR. The first Wednesday of the month, you'll be here with me for the health and medical XR news, and then every third Wednesday, we have the fabulous team that is representing the XR News Innovator Spotlight that hosts Maxwell McGee, Chris Matson, and Tom Furness. And then every second and fourth week, bringing the latest news from across the universe, we have our XR News team, which is made of Laurel, Steph, and the fabulous Karen. And the bonus, all the links to the news and the stories that are covered are posted in our Educators in VR Discord. So at any point in time, you have any questions or want to go back to something we spoke about, please join us on our Discord and you'll find all that information there. All of our shows are a must-see and available for replay on the Educators of VR YouTube channel. The XR News is produced by Educators in VR and run by volunteers, just like you and me. We are wildly grateful for all of our partners, supporters, to keep us going, and this includes the Reinhardt Foundation, Vertex Forum 3D, the Girls STEAM Institute, the Cadets Metaverse, of course, Engage XR, Virtual World Society, and the Immersive Learning Research Network. Without them, a lot of this would not be possible. Oh yeah, and the Bridge Makers. They're such a spirited little team. I love those guys. And if you or your company would like to sponsor the XR News, please contact us at educatorsinvr.com. Now, don't forget to follow us across our social media platforms and on our Educators in VR YouTube channel. You'll find us on LinkedIn, Facebook, Blue Sky, Discord, and then, of course, the educatorsinvr.com website. If you ever have any questions or have any news ideas, please follow us there. Send us a shout out. We love being a part of the community, and thank you for being a part of ours. So before we get on, I once again invite you guys to have some questions ready. This is an immersive fireside chat. So you guys are on mute here at the moment, but later on, we'll give you guys an opportunity to ask any questions or just simply raise your hand and we'll call out to you. So again, thank you for being here and let's dive right in. I'm so excited to introduce to you right now my friend, my guest, Dr. Nick Weir. He is the co-founder of Prothea Kenya, a 3D printing prosthetic company, as well as an orthopedic resident at the University of Nairobi and healthcare innovator. Dr. Nick recently won the Innovator of the Year award in 2025 by Surgical Society of Kenya, proudly supporting VR anatomy classes for undergraduates and currently co-developing an XR medical simulator platform to enhance medical training. Dr. Nick, thank you so much for being here today. I know it's 1 a.m. for you, it's 5 a.m. for me, and everybody else in the
Yeah,
world, thank you. I appreciate us get to be this worldwide diversity group. So yeah, tell us a little bit more about yourself, Nick.
yeah. Thank you so much, Rachel, for the opportunity and the amazing introduction. I'm really happy to be here, and I was really excited for it. My name is Nick Were, born and raised in Nairobi, Kenya. I don't know how many of you have been to Nairobi, but it's an amazing city with a very vibrant tech scene. We have really good internet. I hope it doesn't fail me at this point. and we have a very vibrant social scene as well. So really invite you all to come to Nairobi. It's really the central hub of Africa. I am an orthopedic resident at the University of Nairobi, as stated earlier. I have about a 10-year experience as a general practitioner and a 5-year experience as a surgeon. And I've been able to practice in both the public and private sectors. And basically, I've been able to see it all. Those fortunate ones who have quick and prompt access to healthcare, and those who don't. And for me, I've really been very passionate also about innovation and how we can really change the problems that we see. You look at any statistic in any paper really that you read, and Africa stands, with very scary numbers, be it the doctor to patient ratio, surgeon to patient ratio, maternal mortality, pediatric mortality, accidents, rates of amputations, you name it. Our numbers are always so drastic. And I believe that, we actually have the hardware. It's getting cheaper and cheaper by the day. We have the software as well. We have developers. The world is now a global village. Through collaboration, we could actually get together and have some meaningful impact to positively impact these numbers that we see. So I have a predilection to surgery. I am focusing on amputations, and that led to me starting Prothea Kenya. So we used the 3D printing technology, which has really changed how we make prosthetic devices. We have made it cheaper, but better quality, customized, lightweight. For amputees, they use a lot more energy to walk around, and even reducing the weight of a prosthetic device by even 50 grams is
Mm.
a whole lot for an amputee. And all these benefits have been brought about by the 3D printing technology, and I'll be happy to delve into that. I'm also really passionate about medical education for the few doctors that we have in the continent. And there's also brain drain that is affecting us, and we have many doctors going to western countries to look for a better life. Those who remain, those who stay, to take care of our patients within the continent, need to have optimal training, optimal care with all the resources that we have. And studies have shown that immersive technologies, virtual reality, artificial intelligence, mixed reality increases memory retention, increases the learning capacity for students. And I see it's a revolutionary way of training. And most importantly is also that it's on demand. You can get
Mm.
to train very, very many surgeons at a go, very many nurses at a go, and also enhancing that team collaboration. So, I'm really passionate about it and looking for collaboration to see how we can make it better. Yeah.
No, Nick, I love your story. And every time we interact, it is such a joy because I learn a little bit more and more about you and what your passions and what your all the goodness that you're creating with the world. So to kind of fold this all together, can you tell me how you got into the XR, VR, AI space? Because I know you started in prosthetics, but you've been able to widen your reach through XR,
Yeah.
VR. So can we discuss that a little bit further? Because it's wildly important.
Yeah, I'd love to. So the 3D printing was actually the beginning, because remember, whenever we scan, I'll just go quickly through the workflow. It's very simple. So once the amputees stump, the stump is whatever is left of the amputated part. Once it has healed, then we really strive to get the patient back to walking quick. So we scan, and we scan using a 3D a 3D scanner. We use an
Mm-hmm.
iPhone. And once we have the 3D model, we use an application where we use to make the socket. So the socket goes onto the amputated part, and then we print it and we fit the patient and get them to walk. So this 3D technologies actually got me interested, and I got into virtual reality by literally walking through the malls, because the malls have virtual reality headsets where you pay
Mm.
$5, and for $5 you play 10 minutes of a VR game. So there's the shooting games, and a number of games. And I
Right.
remember getting into the boxing games, and it was very interesting. So to cut a long story short, I bought myself a headset, and I felt like it was a really good workout tool. And then
Mm-hmm.
I started thinking, this can't all be fun and games. What else is being done, with using these headsets? And that got me into the med VR space. So I looked
Mm.
at different apps, associated with medical training and surgery, reached out to a number of them, the psychiatry apps as well, and got to interact with these technologies. And it was really exciting, especially for my good friends in Canada, who have made a precision OS. And this literally has improved my spatial uh, configuration while operating. I find that I'm much better with my angles and have to use less of the X-rays while I'm operating. If you know a bit of orthopedic surgery, we have an X-ray machine in theater. It's called a C-arm, and if you are a bit inaccurate, you can find yourself taking quite a number of X-ray shots. But I can confidently say that with continued practice, the virtual reality has made me become more accurate. Um, and, that's just my story. And I believe that, those are solutions that have been made for the different populations they serve. But we also need to make our applications for our special problems, and that's where we went ahead and teamed up with a friend, and are now creating an emergency medical simulation app. You see the picture there of me at the Kenya Orthopedic Association,
Uh-huh.
showing orthopedic surgeons on the Precision OS orthopedic training app. This is about 2 3 years ago. Yeah, and we've really grown from that.
And when you're showing this kind of technology to your peers, um, does it take, I mean, I'm sure they're like, wow, but then it also takes not only their learning, but the wow factor to a whole new level. And then the confidence that they gain has to be quite large.
Yes, absolutely. The fact that most importantly, you can also train on new and emerging technologies, like this two doctors. I remember talking to them about robotic surgery. Um,
Mm-hmm.
you can do knee replacements using robotic surgery, and there are few companies, worldwide that are offering the service. Now,
Mm-hmm.
you wouldn't believe that the first robot arrived in Kenya a few months ago, and it's being used to do one of the fast robotic knee replacements. This is
Mm-hmm.
technology that has been there for about more than 10 years, but the first has
Oh.
just arrived in Kenya. So you can actually use the technology to spread the knowledge around, to help people practice as we prepare for more and more of these new technologies to come in, so that much of this is a mental game. And once you get the concept and get the sequence of events, then once you have the tangible experience, then it's much easier to grasp. Yeah,
Right. No, I think that is such a great demonstration on exactly what XR, AR in the medical and healthcare needs are truly specifically for. And I love the
yeah.
adaptation and the fact that you're such a trailblazer through all this. Another thing
Thank
that you're
you.
doing in VR is you're working with the anxiety and PTSD for the amputees. Is that correct?
Yes, it is. And we have piloted it, though it's not really mainstream because many of our patients are from lower socioeconomic status. So, bringing a
Mm,
VR headset to them and telling them like this would help you with your emotions, probably PTSD, anxiety.
mm,
Many really suffer lots of this. Psychiatric illnesses because you know amputations really come about from life-saving um, procedures that are done.
yeah.
Amputation is a life-saving procedure many times, either from infection, from trauma, from diabetes, and many actually need holistic, well-rounded care. So we've piloted it on a few patients, and
Mm-hmm.
it has had some pretty good results. For example, my good friends at
Mm,
SciTech were able to uh, p- provide the application for us, and for a patient who was involved in a road traffic accident and had a
mm,
phobia of getting into a vehicle. We were
mm-hmm.
actually able to put them in a vehicle and just go through and decompress and expose them to the feeling of being in a vehicle again. And it actually showed to help because after that, with that rate from a scale of from 0 to 10, how they're feeling, and then we take
Mm-hmm.
them to a AI generated safe place. And at the end of it, we did it for about 2 weeks. It showed to be really beneficial. And uh, they obviously didn't get back onto a car and drive, but they noted that it helped. So these are things that have been studied, and
Mm-hmm.
the benefit has been proven. And the work we're doing is just providing more and more of a use case so that the existing institutions can even invest in these technologies for their facilities. Yeah,
Yeah, I had Peter on. He's one of the VPs for Psych Tech. He was on my last season, and I love what his
fantastic.
app is doing. And it's such
Yeah,
it's a small big world. How this is one of the things I love about XR VR is that you're in Kenya,
yeah,
I'm in Vietnam, Peter's I think he's in Canada. We're all
yeah,
together coming together, and we're solving worldwide issues, and we're having real
yeah.
time, real life results. So it's such a beautiful story. And so the
It
next
is.
thing I really kind of want to dig into is you're also creating a VR program for our great friends at Africa VR campus. Can you share a little bit more about that, what you're doing there?
Yes, so this really came about from a few undergraduate students coming in for mentorship, and they wanted to get
Mm-hmm.
involved, but there's a big problem. The headsets and existing technologies, you would say that the price has significantly gone down, and they're more affordable than 10 years ago, for example, but still $300, $250 is still out of reach for many Kenyans students.
Right.
um, and we were able, through funding and well wishers who have donated to us some VR headsets, we were able to provide these headsets and provide the experiences for them. Now, think of this. Every medical student has to go through an anatomy class. And for me, who studied medicine 15 years ago, I had my own cadaver. We were a group of 8 of us, and I had my own cadaver, and we 8 of us dissected the cadaver from head to toe. So even if the cadavers were not in the perfect condition, but
Mm-hmm.
that experience of actually dissecting the body by yourself, the memory retention was significantly better. Right now, the students go into the lab and the specimens are already dissected. The prosections are already dissected,
Mm,
meaning they just come in and find something that's already prepared, and they have to identify muscle to muscle to muscle. And many times the numbers are much more. Now they're about 20 per table, for example, and
mm-hmm.
um, it's less quality than what I had. Now, in comes VR, where you're able to dissect virtually every single muscle, every single artery, vein, nerve. You see the relations, and be able to surgically plan different approaches to the bone, for example, as an orthopedic surgeon. And it's on demand. You can easily
Mm-hmm.
put a headset somewhere in the medical school, and you don't have to go through the stench of formalin just to learn. You just go to a room, get your headset, and quickly refresh the concepts. And
Mm-hmm.
this is what we're going through with the students, teaching them how to navigate different virtual reality medical applications, and most importantly, you know, questioning them and seeing, preparing them for an examination, because their time with me has to be useful at the end of the day. So this is what we've been doing. We're doing it every month at the moment, and looking to have more partners as well. We could have different classes worldwide, because there's no boundaries with this thing. We could be in a room of medical students and learn a few concepts. The anatomy principles don't change. And yeah, looking to find more, open more doors even for the medical students with this technology. Yeah,
No, that's wonderful. And audience, I
yeah.
hope you're getting some questions ready. I have a few more questions here for Dr. Nick, but in a few moments here, we're going to go ahead and open up the floor. So get ready. I'm going to put you out there. So, Dr. Nick, how long have you been in VR? And do you have an idea of how many students' lives that you've actually touched or doctors that you've actually, have made a change for? And then what does that future kind of look like for you right now?
Yep. So currently, we've started small, and that was our
Hmm.
strategy with Paul, just to start with a small group, make sure that the quality is there. Because again, there's not many headsets. And,
Correct.
we'd
And
like
to
to,
interrupt you, that's Dr.
yeah.
Paul over at VR Africa, isn't that correct?
Yes, yes, yes.
Okay,
That's
cool.
Paul.
Yeah.
Yeah, from Africa VR. Yes, yes. Oh, sorry. I thought you were well familiar with him. Yeah.
No,
So,
I am, but maybe not the audience. So I just want to make sure,
yes,
he's the first
yes,
Nairobian or the first African in VR was Dr. Paul.
yes, yes. Dr. Paul is the first African in the metaverse. And we opted to start small. So with this group, we're taking it a month at a time, a session at a time, but the plan is to actually incorporate this into the curriculum, because it's proven. Again, memory retention, concentration, you have less distractions with this technology. And we actually invite developers to
Hmm.
get more intricate and more detailed, such that you're not just having anatomy models. You can actually get more scientific. And I really loved what Dr. Jane has done, with the microbiology, because that was one really hard topic to grasp. Yeah, so shout out to you. And I'm really looking forward to try out her app. And I was also thinking about pharmacology. Someone needs to develop a way of just mapping out the all of the drugs, using the
Hmm.
audio-visual mechanisms. And this will have a real impact globally. Yeah. And yeah, so we started small. We're a group of about 10 students we're working with so
Hmm.
far. And for the doctors, I've been able to use the mixed reality that we are currently building. We're working on basic life support, advanced trauma life support simulations that are pegged on an African setting. For example, there's
Mm-hmm.
AEDs that apart in the West are very well spread. This is the defibrillators that you use for
Okay, yeah.
CPR. Yeah, so you could start CPR and the syllabus tells you, to get an AED and check if the rhythm is shockable. And if it's shockable,
Mm-hmm.
then you shock with the AED. But in my setting in Nairobi, there are rarely any AEDs within 5 kilometers, 10 kilometers from where I'm sitting. So that's what we're trying to
Right.
do, to just have the local context in check so that we actually know exactly what to do. Instead of calling 911, we'll call the local number, for example,
Mm.
or even put in local ambulance numbers. Yeah, just to have the local context, yeah, for our students. And of course, we're looking into using mixed reality in surgery as well.
Yes.
I'm really interested in people who are doing this. I haven't really gotten to the guy who hold my hand, but for example,
Uh-huh.
in spine surgery, we use the X-rays while operating, and you really need to get it right. Really need to get it precise. There are doctors out there who are using mixed reality, and you can actually have
Mm-hmm.
your angles very precise without using X-rays. Because remember, the X-rays have its dangers, especially with
Right.
exposure to the thyroid, breast cancer for the female surgeons, and
Mm-hmm.
surgeries with less radiation exposure is actually beneficial for both the doctor and the patient. So the horizon is really amazing, and I'm really happy to have such a connected world like we have here, where
Uh-huh.
we're able to learn from each other and build each other. Yeah,
No, I think that's wonderful. In the way that you're approaching this, and your adaptation and your reach is so large. And I personally will send you the information so that you can download Dr. Jane's app. It was just recently released out on the Meta Store. And so you can start
yeah, it's
sharing it with your
fantastic.
students. Yeah. And if you ever need
Exactly. Would be
anything,
happy
please
to.
reach out to the educators in VR. We're always here to help each other to grow. And that's the beautiful thing about being part of this community, is that we're just looking
Yeah,
to foster innovation and people like you who are bringing it into real life to people that necessarily wouldn't have this opportunity. We are
that's it.
passionate about helping. So thank you so much. So I just wanted to
Fantastic.
take a
Thank you.
chance and unmute the audience to see if anybody had any questions or
I do,
anything they
I
would
do,
like to
I
explore.
do,
Oh, of
I
course, Miss
do.
Hilaire. Ask away.
All right.
Ah, Nick,
I
you're
was
so
wondering,
wonderful.
could you walk us, because this is so fascinating to me. Can you walk us through kind of the end-to-end process of how you scan the person's, residual limb with a smartphone, which is just amazing. I mean, that is absolutely stunning to me. And then how you model it and then 3D print it all in, and how long does this actually take before the patient can actually get this thing on them? It's beautiful.
Yeah,
Hey,
it's
and
a
before we do that,
fantastic,
Nick, let's bring in our
fantastic question.
asset. Lance, can you go ahead and bring out the prosthetic? So
The
Dr.
big
Nick was
surprise.
able to take a picture, and yeah, I'm so excited. He was actually to take a picture of an actual prosthetic in real life, and we're going to bring it here into Engage XR. And while we're waiting for the prosthetic to come in, oh, there we go. Wow. So this is an actual
Fantastic.
product. And Dr. Nick, you're the one who took the picture, am I correct?
Yes, yes, I did.
Hmm. All right. So
Yeah,
let's hear about this process. I'm so excited.
fantastic. So, this is a below knee prosthetic. And I'll talk about the traditional means of making it quick. So, also the problem. So, we have a huge amputee load. As I said, most of amputees are from lower, sorry, lower socioeconomic status, have lower socioeconomic status. 200 million amputees are currently, there are about 200 million amputees. 85% lack access to this device you see here. All right, just let that sink in. Only about 15 to 20% have access to this device. Why? It's expensive. And many times, once the doctor has done the amputation, many times we think the job is done. But once you discharge the patient, if you're not able to get him back to his former job, if you're not able to make him mobile with this simple device, then you've lost a taxpayer, for example. You've lost someone's earning potential. This device, the traditional means in a public hospital, would go for about $1,500, give or take. And the process goes like this. You know the plaster of Paris, the casting material? So we'd cast the stump, and once it would solidify, you remove it, and that would be the negative mold. Then you pour in fresh plaster of Paris, and that would make the positive mold. Now, that is the replica of the patient's stump. So the practitioner would go to the workshop and use this positive mold, take some thermoplastic, heat it in an oven, and then come and dress this positive mold. Guess what? In a very well high functioning prosthetic workshop, it takes at least a week.
Oh, wow.
In a normal public facility, that would take a month. So the time it takes to create this device traditionally is so time consuming, and you'd imagine very depressing to the patient. It's also expensive. And not just the financial cost, also the time the prosthetist takes. It takes a lot of his time just to make one device. Now, let's come to Prothea Kenya and what we're doing. The scanner is just on an iPhone. You see the same technology, the same facial recognition technology? That is the same tech that we use to get the model of the stump. So we completely obliterate this POP nonsense, this, well, it's not nonsense because that's what we've been relying on for ages, but it's about time we moved forward. So, once we have you can see the picture of the patient being scanned, and we dress it with a white material and then mark the pressure areas. So there's a lot of science to this, and we only allow certified prosthetists who understand the principles to do this. And then you can see these guys modeling. So once you have the 3D model of what you have scanned, then we have our proprietary application that is we basically modified Blender a little bit to make it suit our needs, and it's called UFit. The application is called UFit, and we've made it very simple for any prosthetist to learn. It actually takes about a week to train them, and many times they're pretty good. And many of the prosthetists we started with are now certified trainers of how to model. And once we've modeled, we send this socket to the 3D printer, and it takes 8 hours to print. So scanning is about 3 minutes. Modeling, maximum 10 minutes. Printing, 8 hours. And in less than 24 hours, Because once we've made the socket, this is the most important component. And remember, it's lightweight. It's made of the
Hmm.
same material that is used traditionally. It's very strong. Many times we even challenge people to break it and they can't. And once we've made the socket, then we connect the rest of the components. So there's a connector over here, there's a pylon, and there's the foot. These we import, right? So once the socket is
Hmm.
ready, we just connect everything up, and literally your patient can be walking in no time. We have patients who fly in on Monday and fly out on Thursday, literally walking with a prosthetic. It's that good.
I'm all
Yeah,
smiles. That warms my heart to take something from a month to only a few days. I mean, the cost of
yeah,
it, just making the device has to be so low, but then also the cost for the patient mentally, physically.
yeah,
I mean, traveling, some
yeah,
people, I can't leave anywhere for a month, and I couldn't imagine traveling back and forth, and
yeah,
the mental
yeah.
toll. Oh, how
And it
beautiful,
gets
Dr.
better.
Nick.
It
Oh,
gets
yay.
better, Rachel. Yeah,
Uh-huh.
because with this technology, you can send prosthetists out into the field. You can send them to the ends of the earth.
Mm,
And as long as you can get me an accurate model, you can email me just like I emailed Laurel this thing, um, this asset, sorry. And
mhm.
we can get designing of the socket done and piece up the whole thing and ship it back to the patient, meaning the patient doesn't have to come to the workshop. We can send the provider to the patient. Yeah,
No, that's
yeah.
beautiful.
And that's another way it has changed, it has changed the game.
Mhm.
Yeah, yeah.
And how many since you've been using the 3D printing um, operation, how many prosthetics have you created thus far?
Yeah, so currently we are more than 600.
Oh,
We
wow.
were significantly boosted by a very gracious donor who gave
Mhm.
us a very tough task. So in 2024, the last quarter of 2024, the guy comes up um, and Mr. Beast tells us that he wants to
Mhm.
provide 300 Kenyans with a prosthetic leg, and he
Uh-huh. And
gave
you're
us
talking
a
Mr. Beast, the
deadline.
YouTube guy, right?
The YouTube guy,
Yeah, no, that's
and
awesome.
yeah, and he gave us a deadline, and through our partners, that's Ugani Prosthetics and the
Mhm.
Ugani Foundation, we were
Mhm.
able to actually make 300 devices within that time. It was a record, really.
Mm.
And, of course, we really spent sleepless nights, got in all the hands
Mhm.
on deck, but we were actually able to make it happen. And this is just testament to the fact no traditional workshop would be able to do that in 3 months, just to show how great the technology is. But sadly enough, this device, even though the cost is reduced significantly and the value has significantly been added, it's still not under the insurance packages, the national insurance package, and it's
Mm.
still significantly out of reach for many, many, many patients. And this is part of the awareness that we are doing. We recently had the Mr. and Miss Amputee fashion show,
Mm,
and this
yes.
was mainly to spread awareness about amputations and the prosthetic devices and getting people back to society and to their livelihoods, and most
Mhm.
importantly also to urge the government to provide these prosthetic legs, because the treatment doesn't end once you're out of the ward or once you're out of the operating table. It really ends
Mhm.
once you're walking around and you're able to get yourself some decent livelihood.
So,
Yeah.
Nick, if somebody wanted to donate or, kind of help with the program, what is the best way for them to get in touch with you? Is it on LinkedIn? And do you have a website? What would be the best way for someone to contribute to such this beautiful and powerful project that you're hosting?
Yes. So another thing, we have tried doing our CSR to the best of our ability. You had a picture of one of the prosthetists who we actually sent to the Paralympics. He was a Paralympic
Oh, wow.
boxer. Yeah,
Uh-huh.
and this guy became so confident, and we told him to keep going to the gym, and he achieved his goals. Guess what? His
Mm-hmm.
prosthetic was absolutely free. So a free prosthetic
Mm.
actually impacts a life directly, and we are able to show that. Um, Now, to be able to donate, you could reach out to me on LinkedIn. That's Dr. Nick Were, and we could discuss the mechanisms of how to get it. Currently, we have a huge database of patients who need prosthetics, and
Mm.
we keep it. And we keep it. You showed a picture of a girl who has been using a stick for 17 years. 17 years, and this metal stick was fabricated by her father, right?
Oh,
Who was
wow.
like, my daughter needs to go to school, and she's been using it for 17 years. Can you imagine? This prosthetic was
No.
donated. We donated the prosthetic to her, and she's now using it in school and is able to go about her education. Her dream is to become a lawyer, and the impact is really huge. So kindly
Mm.
reach out through any of our social media channels, through my LinkedIn profile, and help us make a difference. Yeah.
Dr. Nick, and we will completely help you with that. So this episode, like all episodes, are going to be recorded and later uploaded onto our YouTube channel, and we'll include all this information so not only you can reach out and donate, but maybe just encourage and help with the cause. Because again, as you see how beautiful and meaningful this work can really truly be, and maybe it's affecting just Africa, but his strides will soon be worldwide felt. And being a part of that would be an amazing part. So please join us and help us with Dr. Nick and his entire team. Oh, Dr. Nick, this has
Thank
been
you.
such a fabulous interview. My heart is so warm. It's like 5 o'clock in the morning here, and I'm just like all smiles. And this is such a beautiful thing that you're doing. And thank you so much for being an innovator, a trailblazer, and changing people's literally lives in all of the holistic ways. Like I think it's truly beautiful, and thank you.
Thank you. Thank you.
Did
It
the
means a
audience?
lot.
Can
Yeah.
do we have time for
Did
more
anyone else have any
questions?
questions? Yeah, just a few more.
I'm okay. I would love to hear from anyone else, and then I have another question if there's nobody else.
I
Mm.
was wondering, you show a child being fitted with one. How often do you have to refit a child as they grow? And this would make that more possible because it is less expensive.
Yes, absolutely. So children have really special considerations with prosthetic fitting. One, because the growth plates are still on, and the bones are still growing. And if the appropriate surgical technique is not employed, then you find the bone jutting out of the stump. And many have to go back to theater for surgeons who for lack of a better word, don't know the appropriate techniques. You find many children going more and more to theater. So what we do is actually block the growth plate so that the bone doesn't have to jut out. But also the bones are still growing and the rest of the tissues are growing. So we find children having to be fitted more and more. And that's a reason why children don't really have access to these devices, because again, it's expensive. Fabricating a socket for us is about $300, but elsewhere is a bit higher, and a parent having to do that over and over again is quite costly as the child grows. You find between the ages of 1 to 10, you can even change up to 6 to 7 devices.
Oh, wow.
And it just reminds me of the youngest patient we've done is actually a 10-month-old baby. And the
Mm.
first time we fitted the prosthetic, she was very, very apprehensive and was crying the whole time. And 3 months later, when she came for a refit and a new socket, we couldn't get the socket out of it. Her, like she was literally refusing and almost fighting us to the ground.
Mm.
Just refusing us to get it out. Just to show like this is literally our Prothea baby. So I committed to support this baby up to the age of 6, because for kids it's actually easy. We can actually 3D print the whole limb. So we don't
Oh,
have to put
wow.
all this metal. Yeah, and that
Wow.
makes it even significantly cheaper. We can just make the socket and then do a plastic pylon and a plastic foot, and it works just fine. And the biomechanics is preserved. So of course the kids have the special challenges, and for us, we believe that 3D printing is the solution for this special vulnerable group of patients.
Mm.
Mm.
Yeah.
Well, Dr. Nick, we could sit here and talk to you all day long. I think you touch all of our hearts in so many different ways. And so we need to wrap up the show, but I invite you to stay afterwards, connect with each other, and connect with Dr. Nick and ask any questions. And again, this is all recorded and will be posted on YouTube. So if you have questions later, or if you just simply want to replay, please find us in our Educators in VR YouTube channel. Dr. Nick, thank you again. I really appreciate it.
Fantastic. Thanks for having
And thank
me.
you again for the audience. You are the reason we are here and why we're having part of this chat. Oh, thank you. And I want to thank Educators in VR for producing and encouraging medical and health innovations in XR AI. This is such an emerging technology, and sometimes it gets just very little bit of light shown onto it. So thank you, Educators in VR, Laurel, Lance, Dancer Tree, Steph, and all of the volunteers that became a part of this. Now, again, I want to see you back every Wednesday here and engage for the XR News. With the first Wednesday of every month, you'll be here with me for a medical and health edition. On the third week, we'll have the Innovator Spotlight with Maxwell McGee, uh, uh, Tom Furness, and sorry, I got so overwhelmed with this story. And then every second and fourth, we have
Chris
our XR
Mattson.
News team.
Chris
There you go.
Mattson.
Thank you. I'm really touched. This is such an amazing story. And then Chris Mattson, they're on the third week, and they always bring us some really fun stuff here in Engage. And every second and fourth week, we have this wonderful XR team that bring all the latest and greatest news. It's with Laurel, Steph, and Karen. And again, we're here every Wednesday in Engage at 5 p.m. Eastern Standard Time. My name is Rachel Darden. I'm a health and well-being coach and educator, and I personally invite you to come to Recharge with Rachel D. and every Tuesday at 9 p.m. Eastern Standard Time. And I really hope to see you back here. And if you ever have any questions, please find us on our Discord and all of our social media channels. More importantly, I want to send a huge thank you to our amazing XR News crew. We couldn't do this without you. And we can't do this without everybody that's being involved. And we're always looking for new members to help bring the show to life. We're looking for moderators, speakers, trainers, news reporters, live streamers, and training is always provided. And then also we want to thank again to our incredible partners and sponsors. Without them, this would not be possible. With iLearn, Vertex Forum 3D, the Reinhardt Foundation, Bridge Makers, the Girls Team Institute, of course, Engage XR, and Virtual World Society, and always Educators in VR. So again, thank you to each and every single one of you. I hope to see you here next Wednesday as we review and go deeper into the latest and emerging news. And again, please contact us, reach out to us, give us your questions, because without you, this show would not be possible. Thank you to each and every one of you. And stands with tree, what did we do?
We did a thing!
Oh, yay! Oh, Dr. Nick, this was so amazing.